Okay. Hello, everyone, and welcome to the second webinar as part of our skill sharing series for the Thriving Food Futures Early Career Researcher Network. For those joining us for the first time, Thriving stands for Transdisciplinary Health Research to Identify Viable Interventions for Net Zero Goals. And the Thriving Food Futures Research Hub is a 5-year programme which launched in February of this year, funded by the UKRI and National Institute of Health and Care Research. The hub aims to create opportunities for the public, policymakers, and academics to co-design and evaluate policies that will help people to make shifts to healthier, more sustainable diets, particularly by exploring how food is marketed and sold. I'll add some further details about the Thriving Food Futures project in the chat for those of you who are interested. And as part of this project, we've established the Thriving Food Futures Early Career Researcher Network. And this is to connect early career researchers at any career stage from any institution who share an interest in healthy, sustainable, and equitable food systems and diets. Today, we are very excited to have a presentation from Professor Jean Adams, who leads on the policy work package as part of the Thriving Food Futures Hub. Jean Adams is a Professor of Dietary Public Health at the MRC Epidemiology Unit at the University of Cambridge. Her work explores how the environment in its widest sense, should I say, influences what people eat and how we can change the environment to support people to eat better. And her recent work has explored online delivery apps, menu labelling in large chain restaurants, and the soft drinks levy, as well as the potential for healthier takeaways. And today, Professor Adams will be considering systems thinking for public health and food systems. Now, systems thinking is increasingly discussed in public health circles, often as something new or something with the potential to achieve great change. And in this talk, Jean will introduce systems thinking as she understands it and discusses its similarities and differences from more conventional methodological approaches. Please do put any questions that you have for Jean in the questions box, and please do introduce yourself in the chat if you'd like to connect with others on the call. We have our colleague today, Beth, in the chat reviewing your messages and your questions, and Matea, who will be helping with any tech issues that arrive. So thank you both for supporting this webinar. Thank you as well to everyone for arriving today. And we're really looking forward to hearing from you, Jean. So yeah, over to you if you'd like to share your screen.
Thanks so much, Beth. So let us have an embarrassing pause whilst I work out how to share my slides. So are you seeing the right thing?
Yes, I can see that. That's perfect.
Perfect. Okay. So thank you very much. Let me hide everybody. Okay, so well, thank you first to Beth for inviting me to speak today. My name, as she said, is Jean Adams, and I'm a Professor of Diet and Public Health at the University of Cambridge. I'm going to speak today for about 50 minutes. I don't know what everyone else has got, but I've got a 2-hour slot blocked out in my diary for this. So after I finish speaking, I'm happy to stay on the call for as long as people would like to chat or not chat, but we'll definitely wrap up by 5 p.m. UK time. Struggling to advance my slides. Okay, so I thought it might be helpful to tell you a little bit about who I am, because I think it might help put some of the other things that I talk about into context. So this sort of thing always feels a little bit cringy. So before I show you the next slide, I just want to emphasize that the list of my apparent successes, and I think this applies to everyone who does this, these successes exist alongside like a much longer ghost list of mistakes and failures and setbacks. What I really like about my job is that it challenges me by kind of constantly keeping me at the very edge of what I feel is my ability, and that feels like I'm intellectually always being asked to think creatively. I never get stuck in a rut. But what I really dislike about my job is that I feel like I'm always working right at the edge of my ability. And sometimes it's you find yourself falling over the wrong side of that line. And so there are always lots of setbacks. So I did my undergraduate training in medicine, but even then I was interested in why people did the things they did, particularly related to their health. And so I did a research degree in the middle of my medical degree, looking at health psychology and psychiatry, so why people with severe mental illnesses didn't take their medications. That experience convinced me that I probably didn't want to practice medicine and that I wanted to be a researcher instead. So I went straight from medical school to do a PhD on socioeconomic inequalities in health. And then for about the first 10 years of my postdoctoral career, I did work on a wide range of different health-related behaviours, as they were called. And I was mostly exploring different psychological influences on those behaviours. So I had fellowships that allowed me to look at some specific things like future thinking and financial incentives. But I was a little bit magpie about this. One of my postdoctoral fellowships allowed me to do a master's in health psychology to extend that training that I'd had in medical school. And I think it was during that year that I started to, like, as I kind of really delved further into health psychology, started actually to develop a growing understanding that I didn't think that maybe individual cognitive processes were what were driving a lot of what we might call behaviors, and that maybe the wider environment was as or more important. But even whilst I was developing that kind of understanding or system of thinking in my head, I was finding it hard in the post that I had at the time to move away from a more standard individual or behavioral focus. And simultaneously, I was being told that I was a bit magpie and that I needed to focus, make it clear to myself what it was I wanted other people to know me for. And at that point, I thought that food was really interesting. I still think that food is interesting. And one of the reasons is that we all have to eat. And so we're all experts in food. And so the opportunity to bring those two things together, focus on food and focus on the environment, came up in a post at Cambridge. And I've been here for about the last 11 years. So my work, as Beth said, currently focuses on how the environment in its widest sense, and that by that we mean the digital, the social, the fiscal and physical environment, how all of that influences what we eat and how we can change the environment to help everyone to eat better. So I am expecting, I'll just tell you if you don't already know this, that things like where we live or what food shops are in our neighbourhood, what adverts we're exposed to, how much money we have, and what people like us normally eat. All of these things influence what we eat ourselves. So changing the environment means that we're kind of moving into the realm of what we might call structural or population interventions. So a more behavioural or individual approach to diet would identify those who are currently eating the least healthy food or those people who are at the highest risk of diet-related diseases. And you would work with those individual people to try and help them change what they eat. So colleagues in our department and elsewhere majorly focus on that. And I want to emphasize that I agree that those approaches are helpful. But complementing that, our group is exploring how we can modify environments to make it easier for everyone to eat better. So that might involve things like taxes on certain less healthy foods like sugar sweetened beverages, restrictions on advertising of less healthy foods, restrictions on price promotions on less healthy food, or preventing less healthy foods being displayed in prominent positions in stores, like here around a checkout. So you remember that I said one of the reasons I took my current post was to focus on these more structural environmental population interventions, and I definitely found a home to do that at Cambridge. But as I was settling into that, I then developed a new frustration. My life is a series of frustrations about those sorts of structural interventions. So it seemed to me that we were often implementing interventions that had good intentions, but when we evaluated them, they maybe weren't as effective as we'd expected them to be. But we also seemed to be uncovering kind of obvious weaknesses in the design of the interventions that kind of we should have known before we even started doing the research, that these either weren't going to have an effect or were going to have much less effect than perhaps promised. So I'll give you an example of this. This was the first grant I ever had as principal investigator. So we were evaluating regulations on TV advertising, TV food advertising to children introduced in the UK in 2007. So that's nearly 20 years ago. So as I talk you through this, you have to put yourself in the position of what TV was like 20 years ago. And I'm just going to expect that you can remember that. So the core of this evaluation was looking at the proportion of adverts that were seen on television that were for less healthy foods. So before and then after implementation. So this is a fairly weak study design, but that is not the point of today's talk. So when we looked at children aged 4 to 15, those were who the regulations were particularly targeted at, we found about 6 or 7% of ads that they saw on TV were for less healthy foods. And actually we saw a small increase after implementation of these restrictions. This was not a statistically significant difference. So what we concluded was there was no change in the proportion of ads that children were seeing that were for less healthy foods. But then we weren't actually able to isolate adults, but if we looked at just the whole population, so everyone age 4+, so that's mostly adults, we actually find an increase from before to after. So the proportion of ads that they were seeing that were for less healthy foods increased from 5% to 8%. And this was statistically significant. And elsewhere, we found very good adherence to the regulations. So we had this intervention that people were sticking to the rules. Children weren't being protected from the problem, so there was no change in their exposure to what we might call the risk here. And paradoxically, we were maybe even seeing an increase in adults' exposure to the risk. So this is pretty bad news. And in fact, what we think happened is that because the restrictions were very specific and particularly focused on programming that had proportionally very high child viewership, they were actually driving adverts to be moved from children's programming to family programming. So a cartoon that's on early in the morning that maybe not very many people are watching, but most of the people watching are children, that has a very high, proportionally high child viewership. So that would be impacted by these regulations. But a program after school at 5 o'clock, we used to have a lot of soaps at that time in the UK that kids would watch with their parents. That might have actually, in absolute terms, many more people watching, but proportionally, it wouldn't have particularly high child viewership because there was also lots of adults watching at the same time. So if we move adverts from the children's programming to this family programming, what we get is this: children are still exposed because they're just seeing the adverts in different programs, but actually adults are even more exposed because adults have moved, the adverts have moved to their programming. So this was a really well-intentioned change in the food environment that I suspect we can conclude had actually no benefit and perhaps even perverse effects. Because it was too easy for food advertisers to adapt their practice and move their ads from one sort of programming to another. And in fact, in other work, we found some evidence that there was maybe an intentional campaign to influence the specific design of the regulations so that this adaptation could happen. So this left me a bit frustrated. I was doing this work on structural interventions that I thought should work really well, but when we were evaluating them, we were finding that they were just designed in a way that food industry was able to adapt to. And we weren't realizing the benefits that these interventions were promising us. Which is about when I started to come into contact with systems thinking and systems science. And it started to offer me perhaps some promise. It talked about adaptation, and I felt that that was the problem, that we weren't, ones like food industry were adapting, but public health interventions were not able to adapt. So, which is kind of why I maybe started to take some notice of maybe this might be useful to me. So I really need to say right now and upfront, and I maybe will say it a few times, that I don't consider myself a systems scientist. I don't even think that I know a great deal about systems thinking. I have been learning a lot from colleagues, and I have done over a number of years. And what I wanted to do today was share some perspectives with you in a kind of a spirit of open conversation, collaborative learning, and maybe in conversation we can start to develop our thinking together. So, I mean, there's a key question of what is systems thinking, right? Like, what is this thing that people are promising us might offer more than whatever it is that we do at the moment? So there are lots of definitions, and I'll maybe come back to this idea of it means lots of different things to different people later. But this review by Arnold and Wade attempted to synthesize those definitions, and they identified some kind of key aspects of systems thinking that were included in many definitions that I've listed here. But I think to really grasp what systems thinking is, you need to kind of understand what it is that what the alternative is. And I think, to me, at the time I came across it, the alternative to thinking about what causes stuff to happen was more of a linear cause and effect thinking. So here's an example from Dietary Public Health that I've been thinking about recently. And I'm thinking about this because maybe we don't need any more public health structural interventions if we have Ozempic and Wegovy that are very effective in treating overweight and obesity. So these, if you've not heard of these drugs, if you heard them by different names, these are the injectable drugs that are GLP receptor agonists, often just called GLP-1s, that seem to work. They seem to be very effective in supporting weight loss, and they seem to work primarily by decreasing appetite. So you can think of a simple cause and effect model here, that if you give a patient a GLP-1, that impacts on their appetite, which might impact on how much food they eat. That leads to a change in body weight. And change in body weight can help, for example, diabetic control, and therefore have positive impacts on well-being and longevity. So this is a sort of logic model that I've used to structure my thinking maybe all my life. Like maybe certainly through my education, I've had like little diagrams like this that help me work out what are the connections between different things that seem to be linked. And I would say that even at this level of very linear cause and effect thinking, we're making some progress towards systems thinking in terms of recognizing interconnections. But we can elaborate this sort of diagram, for instance, but just by adding polarity to the arrows. So GLP-1s decrease appetite, so that's reflected by a minus symbol on that arrow, whereas consuming more less healthy food increases body weight, so reflected by a positive arrow, a positive symbol on that arrow. But really, as soon as you start to think about this stuff, you can think, oh, maybe there are some feedback loops here. So as soon as your body weight goes down because you benefited from a GLP-1, you may be going to stop using the medicine because they're not without side effects. And maybe people have achieved the benefit they wanted. They can be quite expensive if you can't access free provision. And that might be one of the reasons people often don't see through the 2-year prescription that's currently offered in the UK. But in fact, I think that there's probably many more than one feedback loop here. So the thing that I've been really thinking about is this thing about if individual food consumption goes down and we have lots and lots of people on GLP-1s, then maybe overall our population demand for food goes down. And that might have impacts on both manufacture of processed food, but also on agricultural production. And that might change the nature of the food that's available to us in the shops. And so we change as a population, we change what we eat. Which is, you can start to see that's quite a profound effect on things that these GLP-1s are having, not just on the individuals who are taking them. And then so we can see sort of feedback loops here. There's also the possibility of emergent and dynamic behavior that because there's less production of less healthy food, less of it being sold by the food industry, that might impact on their profits. They might really not like that and want to really boost their profits again via, for instance, advertising, marketing, product innovation that tries to get us to eat more less healthy food. And in fact, you can think of other kind of really big scale impacts of all of this. Like the food system is one of the single largest contributors to climate change. And so if we have a significant impact on agricultural production of food, maybe we're going to have a big impact on environmental impacts of that, and that might impact on population well-being and longevity in ways entirely unrelated to diabetic control. And of course, there's likely to be many nonlinear relationships here. Many drugs work because, many drugs don't work until you build up enough of them in your system to kind of get over a threshold of effect. And that's one of the reasons that we're told that antidepressants might take a few weeks or months to for an effect to kick in, because you're building up a level of a chemical in your body. And I don't know if GLP-1s work like that, but you can perhaps see the point. Okay, so an important aspect of systems thinking to me is complexity, and that systems adapt in unpredictable ways. So we can develop these hypotheses of what we think might happen. And we're working in a space where we know we can't predict everything. We have to be open to that. Sometimes people talk about systems thinking and complex adaptive systems in the same breath. And like, as I've said, this sort of diagramming really helps my brain. But one of the things I think we have to remember is that systems thinking is not just the diagramming. And just because we've written down absolutely everything we can think of, we have to be humble to the idea that we can't think of everything, and that things might occur that were unpredictable to anyone. And we have to kind of keep revisiting these diagrams. Okay, so maybe I've given you some idea of what systems thinking is. So as I said, I don't consider myself a systems scientist or an expert in systems thinking. And so in planning this talk, I wasn't quite sure what I was going to say, because I'm not quite sure I have the authority to say very much. But what I thought might be useful to provoke a conversation is to tell you a little bit about my journey through systems thinking so far, and how that's changed and evolved a little over time. And then after that, I'm going to give some key reflections that have accumulated over that journey. Okay, so step one in my journey actually was that this is all emperor's new clothes, that we're doing all this already, and that the suggestion that we aren't is like marginally offensive. You're suggesting that I'm not as intellectually creative or flexible as I actually am. And when I say that we're doing all of this already, what I meant is that we're thinking about wider context. We all know that even if we do a regression of exposure on outcome adjusted for confounders, we all know that the world is much more complicated than that. But these are the tools that we have at our fingertips to explore causal relationships. So I think that this level of thinking maybe is perhaps best illustrated in my like from my working life by this, I don't even know what we would call it, MAP logic model that we developed to support our evaluation of the UK's soft drinks industry levy. So this was the UK's tax on sugar sweetened beverages. I think we might have called it a systems map at the time, but I'm not absolutely sure I would still call it that. So we developed this as we were planning our evaluation of the tax to think about what sort of things we wanted to capture. So it has at the core of it this kind of single causal chain illustrated by the shaded bubbles. but it explicitly shows that we think there's more going on than just that. And the difference between the grayed out stuff and the black stuff is what we weren't able to include in our evaluation. What this doesn't do is make any attempt to find feedback loops, and actually doesn't make any attempt to think about things like emergent behavior or dynamic nonlinear interactions. I think of this as the Emperor's New Clothes stage because this is not the first time I've been involved in doing one of these logic models. Like, as I said, this kind of appeals to my brain. And so it didn't feel like anything new to me. Whilst it did lead to our evaluation being multi-component and looking at lots of different exposure outcome relationships, I didn't feel like we were doing anything new. Like, it sort of justified that we had a big multi-component evaluation, and that was great. But it felt like it was just sticking together a whole bunch of stuff that we'd done previously in previous contexts. I think this probably was the first time we presented this sort of logic model to a funder, and we did actually make some very big claims about it, how this was explicitly a systems-informed evaluation, which, as I'm saying, I'm not even sure I believed at the time, but it seemed to go down well. So maybe it's worth saying here that even my journey through systems thinking has been a little bit nonlinear. And sometimes I do come back to this stage and think, yeah, I don't think that there's very much in this systems thinking. It's all the stuff that I was trained to do early in my career. You know, maybe and I do sometimes kind of come down to maybe even 80 or 9% of this stuff is stuff that we already do but we know by another name. And I think I'll come back to that again in the reflections. Okay, but eventually it took me a while and maybe I decided I was determined not to see anything in it. But after a while, I moved into step 2, which is systems thinking maybe is a useful thinking tool. And this was particularly as I learned more about group model building and causal loop diagramming. And so my example of this phase of the journey is actually not from my research area at all. So our department, like I'm sure many of your departments, has an equalities group, and they're tasked with developing strategy to champion equality in our department. And they decided to do a piece of work on improving support for people living with invisible disabilities in our department. And one of the ways they approached this was a group model building exercise with anyone from the department who was interested. To start to explore some of the causal pathways influencing support for people living with invisible disabilities, and then use that as a jumping off point for intervention ideation. So I want to particularly credit Miriam Alvarado, who led this process, as well as the rest of, they're called the Equality Champions in our unit. So the details of this causal loop diagram are not important. The insight here was that, so I took part in this exercise as a participant rather than as a facilitator. And it was the process of building this CLD through the workshop that I felt was really useful. It encouraged a diverse group of people from many different teams in the department to come together, think about a problem that was relevant to them all, but bring all their different perspectives to the table in a really, I felt, mutually respectful and productive environment. And in fact, there is actually quite a lot of research evidence. There's even systematic reviews that confirm that this group model building can help support collaborative, cooperative thinking and help people build trust across sectors and start to see old problems in new ways. So again, I want to emphasize it. The diagram itself is not necessarily the important thing here. It was the process of developing the diagram that I was starting to think of as useful. And systems thinking has lots of other thinking tools that I really like. This website here has some cool illustrations like this. So this intervention level framework is developed by Donella Meadows' group. And there's a variety of other tools that are similar, but this illustrates that there's lots of levers available to us to shift systems. And just like in physics, if you want to shift a large rock, you need a long lever. So we can think in systems thinking that different types of interventions act as longer or shorter levers and achieve larger or smaller levels of change in the system. So this really fit with my already embedded thinking that structural interventions might be more, so changing system structures might be more effective than changing elements within a system. And this sort of framework can be used once you've built your CLD in a group model building exercise. Share this sort of thinking about different types of interventions with people and maybe challenge them. Can you think of one intervention at each level of this framework that we could use in our example to increase support for people living with invisible disabilities? So that led to when Miriam was doing this with us, she did encourage us to use the insights as I've described from the group model building. We used the idea of the intervention level framework to come up with a bunch of different interventions. And they moved from changing structural elements, maybe involving giving information to all line managers in the department on what an invisible disability is, to much more paradigmatic changes like can we change the goals of our department from not just delivering excellent science, but from delivering excellent science and being an excellent place to work, and work to achieve both those goals simultaneously and with as much vigor and effort. I know everybody says they're a great place to work, but it would mean actually doing it. So I said there was systematic review evidence that taking part in group model building can be helpful for collaboration, cooperation, building trust, all those things. There isn't much evidence about whether these thinking tools actually do lead to more effective intervention ideation in the long run, which for me is a frustration. It's actually led to a project that we're just about to start, trying to test whether it does. But it leaves me in a space of, yeah, might be a really great thinking tool, not actually sure that it delivers the key thing that I'm interested in, which is effective interventions. Okay, so the steps I've been through so far are, it was Emperor's New Clothes, nothing new here. Oh, it might be a great thinking tool. Step 3 was kind of back to square one. The promise evaporated, and I decided it was a bunch of unfulfilled promises. Like these are cool diagrams, but they're not getting me anywhere. So this is a different rendering of the intervention level framework that I showed you as levers trying to shift a system in the previous diagram. This one is a pyramid with more effective interventions at the tip of the pyramid. So the problem here is that I really struggled to identify examples of interventions that shifted goals or paradigms in the space of the food system, which is my research area, as I've described. So, I'm excited, as I said, I'm interested in structural interventions. I'm excited to learn that systems thinking says there might even be more effective things beyond structural interventions, or maybe we could think of this as subdividing structural interventions. And I absolutely can see that a major problem of the food system is that it's kind of set up around this goal of generating profit for a small number of companies and a small number of individuals, rather than protecting human and planetary health, which is what I'm interested in. And so that exists within a paradigm of capitalism is great. And therefore, the interventions are something like challenging capitalism, which which kind of leaves me in a space of, are we sure that's the sort of intervention that me as a lowly public health researcher should be getting into? And in fact, like over the last 10 years, I have on occasion suggested to people that we should just nationalize the food system or go full communist. And, they always, as you're probably doing right now, roll their eyes and say, are you serious? So I kind of felt that this space left me in a long, I don't know what it is you're suggesting that is a realistic intervention. You're offering me some promise, but, I'm not seeing that actually translate into realistic stuff that we can do. And maybe left me thinking, so systems thinking developed in kind of engineering, physics space. Maybe this stuff works in that space. I don't know enough about them, but it just doesn't seem to be working for me in what I think might be more complicated, complex systems. Okay, which was really disappointing actually, because I felt like I'd kind of committed to the systems thinking thing that I'd been quite resistant to for quite a long time, and then it, let me down. So it's not like I just couldn't think of an answer or give me an example of a goal or paradigm shifting intervention. I did actually ask people, and for some reason, and I need to now apologize to Harry for this, I asked Harry Rutter at Bath a number of times, why can't you just give me an example of a paradigm shifting intervention? And it's not that he didn't try, it's for quite a while I said, well, I've never heard of that, so I don't believe what you're saying. But the example he gave me was the Wellbeing of Future Generations Act in Wales. So I dismissed it because I'd never heard of it. So I thought it couldn't be that powerful. But then when I actually spent some time trying to learn what it was, I thought that he was probably right, which is why I need to apologize to him. So this is another thing that I don't know loads about, but I think it may well be a paradigm shifting intervention. So Wales is one of the few countries in the world that have enshrined into law a duty for public organisations to work to achieve these 7 connected wellbeing goals, not just in the present, but also for future Welsh people. So these goals have to be taken into account in public policy. Public organisations have to report on what they're doing towards these goals, which means that all sorts of things that might not have previously been considered high priority, maybe like healthy and equitable and sustainable food systems, they suddenly have a foothold if for no other reason than they allow public organisations to say, if they're doing something on that, we're doing something on well-being of future generations and our commitments under the Act. So you can see how this might work, that NGOs can develop packages of interventions, take them to, for instance, a local authority and say, if you're struggling to fill in your well-being of future generations return, maybe some of our interventions would be helpful for you. So a really small, but I think powerful example of this is a project called Welsh Veg in Schools, which aims to get more Welsh grown vegetables into school meals in Wales. So Wales recently introduced universal free school meals in primary school. And so there was this increased demand for food by the public sector. Suddenly they were making a lot more meals for children in school. And a bunch of NGOs used the obligations created under the Act to develop a programme to encourage local authorities to commit to spending a little bit more on food than they might do. But by spending a little bit more, they could provide these extra meals that they had to provide in school, and they could also report on the Wellbeing of Future Generations Act by getting more veg into schools. That supports the health of the children who are eating the food, and it supports the economy of Wales, and it supports a diverse economy, etc., etc. You can see all sorts of positives of this. So that's a small example, but I think I do agree with Harry that this is kind of by changing what the point of government is for, or what we say are our key overarching goals within government, that can, if done well, permeate down across a whole bunch of sectors. Okay, so as I said, my systems journey is not linear because nothing is. And whilst I was moving from step 3, which was unfulfilled promises, to step 4 of Future Generations Act, I was also moving from systems thinking as maybe it's just a bunch of thinking tools to systems thinking as maybe new approaches, particularly to evaluation, but maybe just using methods that I was already comfortable with. This is not about any fancy pants new methods. So evaluation matters to me because I'm interested in how we change the environment to make it easier for everyone to eat well. So then we have to evaluate those changes that we've made to the environment. So this example of systems thinking as kind of generating new insights from old methods is from Elizabeth McGill, who's at the London School of Hygiene and Tropical Medicine. So she was interested in evaluating London's late night levy. So this is a power that local authorities in England have to levy an additional charge on alcohol serving premises who are open between midnight and 6 a.m. So if a premise wants a late night license to sell alcohol, then local authorities can trigger their powers. We will tax you all a little bit more. So there's a kind of a standard schedule of how much the levy is, depends on how large the business is. And then the money that's raised through this has to be used for what are called additional enforcement activities. So that might be extra policing or extra security and other things associated with late night drinking. So Elizabeth and her team wanted to use systems thinking to understand the impact of the late night levy. And I guess it's important to know that pre-evaluation, there was some kind of really strongly in favor of the levy people and really strongly against. So there were some people who thought this is brilliant, it will help to curb antisocial behavior, which is what ASB is here. You know, keep just kind of petty noise, crime, low level disturbance down. So some people thought it was great. There was another camp who were like full anti, who thought this will absolutely kill the late night economy, the NTE is nighttime economy. So, you know, we've done all this work to develop these places which are now dependent for their economies on places being open late night to serve alcohol and be kind of party places. So, so it was fair to say, like, there was an unanswered question here, which was it both or a bit of each or one or the other, which was stronger going on here. So Elizabeth and her colleagues they first used systems thinking to develop a number of a priori hypotheses of the impacts of the late night levy. And then they tested each of those hypotheses. And the interesting thing for me here was that this was entirely qualitative. So they built their hypotheses from reports of kind of consultations. And then so pre-intervention consultations and what people were saying about the intervention before it happened. And then they tested their hypotheses using interviews, fieldwork observations, all the kind of qualitative data you might be familiar with. So this picture is just, I think there was 5 hypotheses, and this is just one of those rendered as a kind of a systems map. So what I really liked about this example of systems thinking to inform evaluation was that it explicitly builds theory and then tests it. And I really liked it because it used methods that I was totally comfortable with. This was not asking me to get too far out of my comfort zone. And I also really liked that it was elevating qualitative methods, which are also often kind of dismissed as a bit descriptive, you know, not generalizable. It was elevating that to be able to be something that you could draw causal inference from. So, I mean, it's feasible that there is nothing massively new in this, and we might call this just a theory, a really well done theory-informed evaluation. But if nothing else, it helped me see exactly how you might do that. And it kind of pushed me into, okay, this is how we might use these systems maps to inform evaluation. And good examples of, like really well done examples of things I think are useful to help us all push our practice forward. Okay, so I wanted to talk about a step 6 here, which is new insights from new methods. So Elizabeth's example was new insights from old methods, but there are obviously new systems thinking methods are new to me. I was trained, maybe as many of you were, in public health and epidemiology. And particularly, I'm thinking here about systems dynamics modeling, which is essentially a process of layering up numbers and quantitative relationships on the more qualitative maps that I've showed you so far. And I think that this can help move these maps and diagrams from something that helps us structure our thinking to something that can make, I'm going to say concrete predictions, but you know, it is modeling. It's not, we're sure this is going to happen, but it's kind of helping us by enumerating things, saying which pathways might be more or less important, how feedback loops might play out over time and lead to unexpected things. So the reason I don't have a good example of this is because it's right on the edge of my knowledge. I am peripherally involved in some systems dynamics modeling work at the moment, and we have more planned for the future. But all of these, but none of it is, I think, ready to share right now. So this is kind of work in progress, and maybe there are more steps after step 6. This is where I am at the moment. Okay, so then I was going to end with some reflections on my journey in systems thinking so far. So my first reflection is that when people use the term systems thinking, they often mean really different things. This is a table from a systematic review that Chloe Clifford Asprey did on the application of systems thinking to non-communicable disease prevention. So these were there was like 112 papers in the review, and Chloe grouped them into different methods used. You can see there's a lot of them. There's, in fact, if you go to this paper, she then cross tabs these methods by different parts of the policy process or different questions that were being asked. And so you can kind of really quickly see that this gets really complicated. Like, if one person means systems thinking is drawing a systems lens to a question of what interventions we could do, whilst another person thinks it's concept mapping of what's causing the problem. Like, these are just different things. And so you can see how really quickly we start to talk across purposes. I mean, this is not helpful, particularly to like a newbie, but I think I've come to just accept that there's nothing much you can do about it. You just have to roll with it. Once you realize that's what's happening, I mean, that helps you make a lot of progress into, okay, maybe I should just check what that person means by systems thinking before assuming it's what I think they mean. But it can be really frustrating in the new learning stage. So my second reflection is that systems thinking is about the research questions we're asking, not necessarily about the methods. Some questions demand different methods, but it's not necessarily a new suite of methods. It's a new way of looking at our problems, I think. So I used the example of Elizabeth McGill's evaluation of London's late night levy to make the point that systems thinking might well use methods we're all familiar with, but seeks to kind of push us to see the world differently and ask different sorts of questions. So she was asking questions about how does the system adapt to the intervention, essentially. I think that's reflected in this table from the new MRC, not that new anymore, MRC guidance on developing and evaluating complex interventions. So it lists these 4 perspectives on evaluation. And I guess we're maybe all familiar with the distinction between an efficacy evaluation of does the intervention work in ideal settings and an effectiveness evaluation of does it work when we just kind of let it loose in the real world and don't keep the setting ideal. And then maybe we're all starting to think of more theory-based evaluations of what might influence whether the intervention works, how does it work? And then I think that then bleeds into this 4th category of a systems-informed evaluation, where we start to ask slightly different questions about how the system and the intervention are adapting to each other. And I'm absolutely sure that there is overlap, certainly between these last 2 categories, and there's a grey area between, which is why I think that sometimes I land on that example from Elizabeth was a really good example of a theory-based evaluation, or maybe it was a systems evaluation, depending on which way you look at it from. And maybe also I think that says something about why sometimes this stuff can feel like emperor's new clothes, right? A really well done theory-based evaluation is something that I have known about for a while, right? That doesn't seem anything new to me. Whereas if you kind of take that tiny little extra step to flip it into a systems-informed evaluation, that, again, that's not anything massive new. You've only taken a little tiny extra step, but maybe that opens up some more bigger steps that you can take to be very firmly in that box. Okay, so reflection number 3 is about how asking different sorts of questions through systems-informed stuff can perhaps unlock insights. I was going to say that have eluded us, but I think it's just have eluded me, maybe for many years. So if you remember my original example of my frustration with structural interventions, I think that when I go back to this, I can now start to unpick with a new vocabulary what might have been going on, but also how we might have done it better. So these restrictions, you'll remember, led to no change in children's exposure to TV food advertising and an increase in adult exposure because of the shift of adverts from kids to family programming. So it's now a lot clearer to me that what happened is that the food industry rapidly adapted to finding other ways to advertise to kids. It's difficult to say after the fact whether that was predictable or not, but I think feasibly it was. Now we would predict it, having had this experience. But more importantly, it makes me reflect that rather than ask the simple question of, did the intervention impact and the outcome of interest, we should have probably been asking more expansive systems-informed questions, like how does food marketing adapt to restrictions in one part of that food marketing system? And perhaps other people would have known to do that at the time, but I didn't. I think the other side of this story is one that I'm still kind of trying to get to grips with. And if it's that we're confident that systems can adapt in predictable and unpredictable ways to our interventions, then we then have to be able to find ways either to design more adaptation-proof interventions or allow our interventions to adapt in series. So these sorts of regulatory interventions that require legal instruments to make them happen are often really hard won. They're long battles to get these through, and is my experience in the UK. They can often be delayed, and they're often watered down in that process, which is like why we get to this experience of them not being as strong as they could be. And I think that that's why often we don't build in adaptation, because it was so hard to get it done in the first place. Let's not revisit the argument again later on, but I think in an ideal world we would, and we need to find better ways to do that and revisit interventions as we understand how the system is adapting to them. Okay, so my fourth reflection is that systems thinking can be powerful, but reality is more powerful. And my illustration of this is the Mandala Consortium, which is a big 5-year program that I'm involved in that is funded by UKRI under their Transforming UK Food Systems programme. So we receive lots of money to research how we could do urban food systems transformation, specifically in the city of Birmingham in England. So this was a strongly systems-informed project. It's still going on. We used lots of the tools and ideas that I've shared with you today. We worked with stakeholders to understand subsystems and to generate ideas for interventions. But when it really came down to it, we found it hard to find powerful interventions that people were willing to implement, particularly in the commercial sector. So Alexia Sawyer wrote a really nice paper that's just been published, kind of describing the opportunities and the challenges of the systems-informed approach we took. And I think a key finding from that paper, or limitation of our experience, was that systems thinking is powerful, but the commercial food sector is a lot more powerful. And I'm still not sure that we've worked out, like, if group model building helps us kind of cooperate across sectors, how do we then help it generate shared commitment and then actual delivery of what we all agree might be the most effective interventions? Which I think is all maybe just to say that systems thinking is not some magic panacea, just like nothing else is a magic panacea. It gives us more tools in our box, but it's not fundamentally a different box. Okay, and my last reflection is about knitting. So I've found this all a bit overwhelming at times. Maybe learning any new big thing is overwhelming. I still don't feel, as I said, I still don't feel like an expert in it, and that I still feel a bit overwhelming makes me think I'm still in actually a very early phase in my learning on this. So one of the things I actually do when life is overwhelming is knit, because I find that it calms my brain. But I actually also find myself on occasions overwhelmed by knitting, because like the basics of it are easy. There's very few techniques. But I really wanted to like move past following other people's patterns and learn how is it that you create unique, beautiful garments yourself, like that come entirely out of your own head. And that just feels like an unachievable goal sometimes. But lots of people do it, so why can't I? And then I read this book by Elizabeth Zimmerman, and who reads like she was a very no-nonsense lady. She was born in 1910, and this book was written in 1971. And a knitting book that's not, that's still in print 50 years later seems like an amazing achievement. So she clarifies that there are very few knitting techniques, like I've said, and there are actually only a very few basic garment designs, which was a revelation to me, although it's true now that I think about it. And she just encourages knitters to understand the range of options available to them and then just do what works for them. And she's very clear that there's no right or wrong way to knit. So she, not just in knitting, but across actually a lot of my life, she taught me to trust myself and just to have a go. That what you have to do is make a start, allow things to go wrong. The worst that can happen if your knitting goes wrong is that you just have to pull it all out and start again, which is no big disaster. But she also taught me to kind of have confidence in my knowledge of the basics, and that if I run up against a problem, all I have to do is like give my brain some time to work through, here are all the possible options to solve this problem, work through them systematically. Eventually you'll get to one that works in this context. And I think that research is very similar. I don't think that there are like right or wrong ways to do research. I have a colleague who says, as long as you do it carefully and thoughtfully. So, we all have to make compromises. Our research is never perfect. Systems thinking is just another thing that can help us solve problems that we come up against. And I think if it works for you, for whatever purpose you're bringing to it, then go for it. But it's not, as I said, not some magic panacea. There are lots of other ways to solve similar problems that might achieve similar results. And that's where I'll leave it. Thanks very much.